We're going to be showing you guys how to do lumbar McKenzie exercises today. These are a common exercise that we prescribe a lot of our patients. There will be 4 different exercises, and unfortunately all of them are performed in a different position. So we're going to start with what's called a prone press up. Dr. Sarah's here is going to lay on her stomach. She's going to pretend as if she's doing a push-up, but she's going to keep her hips glued to the table. So if you'll notice, she'll lift her upper body up off the table. You want to take a breath. As you exhale, you'll feel the back muscles sort of relax. After you do that, you can lower yourself back down. We perform this exercise 10 times. If this is too much for you to tolerate, so if you're getting too much pain and you can do a less intense version of this, you can prop yourself up on your elbows, in which case you just hold this position. So this is not one that is done with repetitions. This is held for an extended period of time, 3-5 minutes, somewhere along those lines. If this is also too much for you to handle, you can do a similar maneuver where you simply lay down, cross your arms, and rest your chin on top of your hands. Dr. Sarah will show that for you. So all we're trying to do is get a little bit of extension in the lower back. We're now going to move on to the second exercise, which is called a bridge. Dr. Sarah's going to flip over onto her back. You're going to have your knees bent. You're going to lift your hips straight off the table until your knees, your hips, and your shoulders are all in one straight line. You'll then lower your hips back down at the table. If this is too easy for you, you need to make it slightly more difficult. If you put your hands together and push your hands straight up into the air, like Dr. Sarah will show you here in a second, it will make your back rounded, give you a less stable base, force you to use a little bit more musculature just to keep your balance. And you would perform this 10 times. This last exercise is called a sit to stand. So you need to find some chair to sit in, some table to sit on, something to sit on the edge of. You're going to go from the seated position directly up into a standing position. You want to avoid rocking forward and using your momentum. And you want to avoid using your hands to push off your legs. So if you pay close attention to Dr. Sarah's form here, she's the same going up as she is going down. She's not plopping down into the seat. She leans forward to get her weight over her knees, and then she slowly stands straight up into the air. In order to make this easier, if you cannot tolerate doing it on a chair, if you do it on the armrest of a large chair or a low countertop, the higher the surface you're sitting on, the easier it is for you to perform the activity. And if you need to perform it on a chair in front of a counter, holding onto a counter, you can do something like that to help yourself along the way. There's an alternate version of that first exercise, which is called the prone press up, called a standing extension. What you do is you put your arms directly out in front of you, you lean into the wall slightly, and push your hips forward. This creates the extension in the lower back that we're looking for. So if you notice, there's no movement in her knees are not bent, her elbows don't bend, she's not performing a wall push-up. Straight elbows, straight knees, push the hips forward.